There are a variety of issues within our communities. The topic at hand is a prominent problem about the costs of healthcare being unaffordable for low income families. What does this issue regard? Affordability of healthcare depends on a variety of factors such as health insurance, household incomes including poverty struggles, and education levels, which typically increase access to quality healthcare. Not only is it costly, but in many cases healthcare is inaccessible. Many are affected by it, and it impacts our economy. Now, why is this so important? Well, with rising costs and uninsured patients, hospitals won't be able to deliver adequate care, and patients will struggle to afford medication and procedures needed for survival. This then significantly impacts their lives by having the burden of financial instability, straining not just their wallets, but mental health too. Additionally, an ethical concern is introduced because healthcare services are appearing more of a privilege when it should be a fundamental right. So, what's behind all of this? How did we get here? A few things are contributors, such as events after World War II, because the economy grew and caused a higher demand for healthcare, making those costs increase. There was also inflation in medical prices due to technological advances and new prescription drugs. Gentrification in Brooklyn was another factor in which a new demographic was created. Prices of living, including health services, were raised for low-income residents, therefore favoring the wealthy newcomers. Lastly, a proper system wasn't implemented due to a series of policymakers' decisions in the 1990s, which resulted in a market-driven financing infrastructure in replacement of the previous regulation of healthcare pricing. In this graph, we can even see how the increased spending of the city's hospital caused an overall rise in healthcare expenses. In today's world, the cost of hospital services have significantly increased for a few reasons, including taxation on those services and insurance premiums. The cost of living in New York City increasing is becoming a burden onto many citizens and is causing a declining trend of healthcare security. You may be wondering, who is affected by this particular issue? This would be certain people of color, like Hispanic, American Indian, and Alaska Native individuals, which can be seen in this graph of 2023 depicting uninsured rates among population ages up to 64. Additionally, 46% of Black Americans and 52% of Hispanic Americans reported inability to afford quality health care. Other affected individuals are people receiving low to medium incomes, elder folks who overall present more medical needs, people who have lower levels of education, and this chart showing the percentage of immigrants who are without health insurance. Immigration status can affect eligibility for public benefit programs, therefore restricting access to health services. Now what? It's very important to me that this topic is spread, as it's my goal to learn as much as I can to then transfer that information, helping others. What can you do to help the situation? It may not seem easy to target such a national issue, which is why the small initial steps are what can help make a difference. Spread the word. It is so important to inform others about this crisis, whether verbally or creatively, like putting posters up. Additionally, if you or someone you know is in a position to donate, do it for organizations that are actively combating this issue, or even directly relieve lower income families. Sharing your stories and in learning about others is a great way to help shed light onto issues and possibly have them acknowledged by decision makers. You can be a part of a community that volunteers, protests, and advocates for others, helping educate many on the topic of healthcare. In conclusion, it's beyond encouraged for you to take these steps in order to become an active advocate within this matter and help communicate to others so they can be taught. It's crucial to understand the impacts of expensive healthcare onto low-income families. Healthcare is just as important to anyone else as it is to you. Be a part of the change to make it accessible and affordable. Thank you for watching, and remember to act now.